My question is to the Minister for Health and Wellbeing. Can the Minister please advise my constituents on how the government is endeavouring to address the critical shortage of psychologists in regional areas? And when can my constituents expect improved access to affordable and timely mental health care? With your leave, sir, and that of the House, I'll explain further.
Leave is sought. Is leave granted?
Yes, sir. Thank you. Constituents in my electorate, regional electorate, are facing significant challenges in accessing psychiatric care, particularly for ADHD medication prescriptions. The few local specialists available have lengthy wait lists, leaving many with no choice but to seek costly telehealth consultations, often with interstate specialists, with fees up to $700 with only minimum Medicare rebates.
The Minister for Health.
Thank you very much, sir, and I thank the member for Stewart for his question. It is an important question in terms of our mental health workforce for his community, but across the state and across the country as well. The member's question was in relation to psychologists, which is an important issue. The explanation then went to the issue in terms of prescribing medication for ADHD, which would be psychiatrists who would provide that service, both of which there are workforce needs, and I'll address both of those. In terms of psychologists, we have been working with the relevant workforce groups and unions in terms of the development of a psychology plan for SA Health in particular, but understanding as well that the psychology need is not just in terms of SA Health, but my colleague, the Minister for Child Protection, employs many psychologists, the Minister for Education employs many psychologists, but of course in the community there are many psychologists who provide important services under the Better Access Medicare scheme and other private referral services that people need to be able to access. And right across the country there are issues in terms of the availability of those psychologists, particularly since NDIS services as well is an increased user of those services as well. And so we're working in terms of how do we unleash a further pipeline of psychologists, understanding that there is a large number of people who go in to undertake bachelor's degrees in psychology, but it's a very small number of people who end up at the end of that funnel who are able to provide services as a clinical psychologist. The key issue is how can we create that capacity for the university in terms of the master's degrees and other pathways for people to go from that bachelor's degree into be able to provide clinical practice. A lot of that comes down to supervision, and give credit to the Albanese federal government who have invested somewhat in terms of increasing that capacity for additional supervised places for that to happen, but we'd like to see more of that. In relation to ADHD, which is an increasing need in the community, and we have seen an increasing number of demand for those services and demand for that medication. That has put more strain in terms of the psychiatric workforce across the country. That's why one of our election commitments, in fact, was to develop with the Royal Australian New Zealand College of Psychiatrists a dedicated workforce plan for the availability of psychiatrists, understanding not only needs such as the one you've outlined, but also the increasing number of mental health beds we're putting in terms of public services, but also other private services as well, in particular increasing needs for kids and child psychiatrists as well. And so again, it is about how do we create that training pipeline. So we've been working on that plan. It's very close to completion. I look forward to releasing that shortly, which will chart the way for how we can increase our numbers of psychiatrists here in South Australia into the future. In terms of ADHD in particular, one of the issues that has been raised in particular by the Royal Australian College of General Practice, but also a number of other stakeholders, and has been recently raised in Western Australia, and the Western Australian government have made a commitment in terms of could the scope of practice for general practitioners be increased to allow them to make those assessments in terms of ADHD and prescribing of that medication. That is something that we are interested in exploring and looking at whether there's a change that we could make in South Australia. We're talking to Western Australia about the work that they've done in this area, and ultimately that would unleash a big additional capacity for people to access that ADHD assistance.
The member